Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
You bend down to pick up something and suddenly your back reminds you who is really in charge. Today, we reveal the most common questions patients ask about back pain, injuries, and disorders, as well as answer your questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Barbara, who asks, "Hey doctor, I've had back pain for many years, and I've lived a pretty sedentary life because of it. But I've been diagnosed with osteoporosis now, and I've been told to go to the gym to build up my bones. Any advice?" Hi, Barbara. Questions about osteoporosis are some of the most common questions that we get. So first of all, I want you to know that osteoporosis without a fracture is not going to be the cause of your pain. Osteoporosis just means that you have weak bones, and theoretically, it means that you are predisposed to fracture. But unless you have a fracture already, that is not going to answer the reason why you went to the doctor in the first place. So first, let me address the second part of your question. In terms of going to the gym to build up your bones, I think it's a great thought. I think we've been saying this to patients for years, that you need to be active in order for you to achieve maximal bone mass. But I think that at the stage where you are already diagnosed with poor bone quality, it is important to go to the gym as well, but for other reasons. The reason is, I don't want to give you a false sense like you're going to go to the gym and make your bones not osteoporotic. It's a slow process that happens throughout our life. And if osteoporosis is relevant, as in it's significant and the risk is high, or you've already had a fracture, then the answer to treat osteoporosis is not via loading your bones, but is via seeing a specialist and possibly taking hormone agonists, specifically parathyroid hormone agonists, which, unlike Fosamax or some of these other common anti-resorptive medications, will just help slow down degeneration of bone. You will get something that actually builds your bone. So that's an important point. And for those of you who are listening, who are wondering about osteoporosis, there's some really good evidence, recent studies that show that despite your great attempt at strengthening your bone by drinking a ton of milk, taking calcium or vitamin D, these attempts may be a lot more futile than we thought in the past. And if you have indeed osteoporosis, it is time to see a specialist about it, because we finally have medications that can help reverse that. Now, when it comes to chronic back pain, I'm glad you're seeing a specialist. So, Barbara, from my standpoint, I'm bummed to hear that you've had a sedentary life because of back pain. And as a person who had back pain and when he was forced to have sedentary life, I commiserate with you, and I'm excited for you to get to the bottom of why you're hurting and take care of this problem so you can get back to enjoying your life. Thank you for this question. Our next question comes to us from Stephen, who reached to us on YouTube. Stephen's question is, "Dr. Brusovanik, please tell me what kind of doctor I should go to for a thorough evaluation of my lower back pain. I'm 56 years old and generally in good health. I want to find out what's wrong." Hi, Stephen. Thank you for reaching out. And again, great question. And before I do, I would just like to briefly mention the 5 most common causes of back pain, because you will see how that ties in to your question about which specialist to see. So first is herniated discs. Herniated discs afflict all of us, and all our discs eventually herniate and degenerate. Now, specifically, in the realm of spine surgery, a herniated disc is something we see more in the younger population, perhaps younger than 50, where a disc tears and a little piece of disc sneaks out and starts to hurt a nerve. It can also cause a lot of back pain. So for that problem, young person, acute searing pain going down the leg, the right specialist to see would probably be a spine surgeon like myself, an orthopedic or a neurosurgical trained spine surgeon. Next, degenerative disc disorder, another common cause of back pain. So unlike a herniated disc where a disc tears and something comes out, a degenerative disc essentially is like a donut that gets flattened and widened after you stepped on it. So degenerative discs will frequently produce on-off kind of sporadic pain. And if you've started to see episodes of this kind of pain, it's reasonable to speak to a primary care doctor, especially one who specializes in sports medicine. These doctors are very well equipped at differentiating pain from a degenerative disc versus from a herniated disc. And some of the conservative things that are in the realm of family medicine, sports practice, such as non-steroidal anti-inflammatory medications, as well as steroidal medications, steroids, and even some injections. That's really the first line, and that's what helps a vast majority of patients with back pain. Then we have spinal stenosis. So these are patients who have a difficult time walking. These are usually elderly patients, and they usually will see a family doctor with some regularity. If you were to explain to your family doctor, hey, I have back pain, I can't walk too far, but I can sit, most well-trained primary care docs will immediately pick up on this being what's called neuroclaudications, and they will recommend you to obtain an MRI, and they will likely send you to a specialist like myself. Next, osteoarthritis. So we get degenerative change in all our joints, including the joints that are in the back of our spine. Now, some of these joints will really hurt if you go out and play golf or play tennis hard, and these patients are usually somewhat older, but they'll complain of significant stiffness after playing. So the best doctor for that would be an interventional pain specialist, because medications for these kind of post-golf pains aren't that effective and do come with significant issues in causing irritation to your gastrointestinal tract or your stomach. But an injection into those very joints in the back of the spine may really change the weather for you. So seek a pain management specialist just like that. And don't be surprised if those can be both anesthesiologists, neurologists, and even family practitioners. They all practice pain management to some extent. Last, we have muscle ligament sprain. So that's a very common one, and oftentimes we have back pain, and it's muscle pain. Now, if it just came after you moved furniture, if it came after you played sports real hard, now you can't stand up straight, consider going to an urgent care center. Some muscle relaxant, perhaps a steroid, an intramuscular injection, and you should be as good as new. Now, that being said, if your muscle strain has a real cause and is getting better, there's nothing to worry about. But if your muscle strain comes after something seemingly innocuous, like lifting your cat or bending over to tie your shoes, and it's not getting better, then you're back to possibly either seeing an international pain specialist or a spine specialist like myself to obtain a proper MRI. I know this was an exhaustive answer. I hope this helps you and some of our viewers. But getting back to your question, Stephen, so with regards to being 56 years old, being in good health, and now what kind of doctor should I see? The probability is that you're going to have some element of a degenerative disc. So I would see a specialist, an orthopedic or neurosurgery specialist, or I would see a pain management specialist if your insurance allows to obtain an MRI. Otherwise, consider just seeing your primary care doctor for the same purpose of a proper evaluation, obtaining an MRI, and finally getting at the diagnosis. Okay, great question. Denise reached out to us on our YouTube page, and her question to me is, hi, Dr. Brusovanik, I sometimes get sharp lower back pain, which I normally associate with picking up and carrying around my young children. But as a weekend warrior on a tennis court, I'm wondering if that could contribute to the problem. It's a great question, Denise. So good for you for hitting the courts, super important. And thank you for asking this very, very important question. So how do you differentiate? Well, My tennis players will say that they're pretty normal, and then after they play, they have to pay for it. They say, golfers say the same thing, by the way, that they have to pay for it with significant stiffness. Now compare that to pain that occurs after doing something heavy, something that's outside of the normal sort of realm of your physical stress. You could see how that can pull a muscle, and that can result in a common strain or sprain. So if you're a weekend warrior and you want to hit the tennis court hard, then consider seeing a specialist for that post-game stiffness. But if you have pain doing minor activities, day-to-day activities, then I would take it one step further and really obtain an MRI and truly understand why you're having this pain, likely related to one of your discs. I hope this helps. Welcome back. Zachary sent his question via our very own website at allhealthtv.com. Zachary asks, hey, Dr. Brew, I know you are a minimally invasive spine surgeon, but please tell me more about the difference between you and more general surgeons when it comes to spine and back pain. Zachary, that's a good question. Great video. Zachary, so bottom line with minimally invasive spine surgery versus what you call general surgery. It's the general effort to minimize soft tissue trauma, to achieve the goal of the operation without cutting any corners and without causing as much harm as would necessitate months and months of recovery. Now, I don't think that it's fair for me to put myself into a different category. In the end, I'm just a regular, well-meaning spine surgeon, but I happen to have been very lucky with professors that specialize in minimally invasive technique throughout my training, including my fellowship. And the way that I learned to operate is actually the way that I think you'll see most younger surgeons doing it coming out of training. The general direction in surgical care is to minimize soft tissue trauma, to minimize the harm that the patient has to incur in order for us to achieve the goal of the operation. So from that point of view, a minimally invasive spine surgeon is something you should really seek. And at this point, 2026, it's really hard to justify doing big, wide open surgery with significant trauma. Definitely talk to your doctor and ask your doctor about what techniques they use in order to minimize the difficulty of your recovery. Thank you for this question. Our next question comes to us from Abe, who asks, hey, Doc, I've been having back pain lately, so I went to my PCP last week, and he said that I have osteopenia. That wasn't what I expected to hear because I always thought that was something that only women get. He said it really increased my risk of a fracture. What can I do to make things better? Okay, so first of all, this reminds me that we had a question earlier about a patient who went to see a doctor and was just told that she has poor bone quality. It would be very important for this patient to know whether they actually had a fracture and whether their poor bone quality is actually creating a problem that's causing their pain. Now, Abe, in your case, you went to a primary care doctor, and I assume, just like that previous patient, you incidentally found out that the quality of bone is poor. You were not told that you have a fracture. So with regards to poor bone quality by itself, we all get it. And the important thing to know is that the age of milk and the vitamin D has sort of come to an end. We can do better than just wishful thinking by asking patients to down gallons of milk. So we have great medications now with a very low risk profile that will help you build bone. So to answer your question directly, what do you need to do to make it better? You need to speak to a rheumatologist. That's the specialty of doctors that deals with bone health, and that's the kind of a doctor who will specifically prescribe the right kind of bone strengthening medication for you to truly make things better. Great question. Thank you, Abe. Next up, we've got another question from allhealthtv.com. You should really check out our site when you get a chance. It's chock full of really important, good information. Winnie asks, hey, Dr. Brew, the nurse at my daughter's school called me a few days ago and said that she noticed my daughter leaning to one side when she was walking down the hall recently. She suggested I get my 12-year-old tested for scoliosis. Does this mean my kid will have to have back surgery? Winnie, this does not mean that your child will need back surgery. This means that you have a well-meaning caring nurse at her school who somehow noticed an asymmetry. Now, the thing to do when Winnie comes home is to simply ask her to keep her knees straight and her feet level, and then ask her to bend forward and touch her toes. Look over the horizon of her back, and if you're looking right over her back, you'll see that her back has two sort of mounds that come to a trough, which is where the spine lays. Now, if those two mounds are symmetrical, when she bends forwards, then she has a negative Adams forward bend test, and she does not have scoliosis, to a 5-degree margin of error. Now, if you find when she bends forward that there is an asymmetry, then I would consider talking to your doc, possibly get a set of x-rays so you can truly quantify the degree of scoliosis. But that being said, a 12-year-old, it's important for you to know whether her menses or her periods have started with regards to the rapidity of worsening if she does indeed have scoliosis. Otherwise, it's rare to have surgery on minor curves, and I would strongly encourage you to obtain a second opinion if your doctor deems your daughter eligible for scoliosis surgery. I hope this helps. This next YouTube question comes to us from Archer. Hello, Dr. Brusovanik. I finally went to an orthopedic doctor after years of back pain. Good to hear. I was diagnosed with severe degenerative disc disease. Please tell me more about the stages and what I can do to keep this from getting worse. Archer, this is an internal problem. Your discs degenerate, and if they are symptomatic, if your discs are causing you to have pain, then you have a degenerative disc disease. Severity of it depends not only on the MRI findings, it depends on how badly is your pain. And if you are unable to get out of bed like a normal person, if it takes you a few minutes just to stand up straight, if you can't sit through a meal, if you can't sit in the car because of back pain, if standing is an agony and you have to sit and then after you sit, you have to stand, then you have severe degenerative disc disease. And what can you do to keep it from getting worse? Unfortunately, there's really not much that we can do to prevent disc degeneration. Now, we have a lot of things that we can try to stave off surgery and to try to make the episodes of pain less terrible. But even then, the treatments are a bit self-limited. Now, what works in my book the best are epidural steroid injections. If a disc becomes symptomatic and starts to bother you, if it's starting to cause you to have back spasms, then it's reasonable to find exactly which disc is bothering you and to address that disc. If an injection about that disc doesn't change the weather, then what you can try is talk to a specialist like myself about a disc replacement surgery. And that will take care of that disc. If it's indeed symptomatic, the pain will be gone. But listen, this is not a diagnosis. Do not catastrophize over this. This is just a reason, an explanation for why you have back pain, and it can be addressed. You can live with no pain. Thank you, Archer. I appreciate this question. Lola just sent in another question via YouTube. Lola asks, hi, Dr. Brusovanik, when a patient comes in with back pain, how do you determine whether it's coming from a disc issue or from surrounding musculature? Lola, love this question. Thank you for reaching out. It's almost always related to muscle. If it's back pain, it's almost always muscle. Neck pain, it's almost always muscle. If the pain starts to go down your extremities, that's nerve pain. But otherwise, 8 out of 10 times, your back pain is muscle pain. But why is your muscle hurting? If you were moving furniture, if you got into a fight, if you had an accident, then you can have muscle pain from strain. You can have muscle pain from overuse. And that muscle pain will reliably get better. It doesn't keep coming back, it just gets better. Now compare that to a patient that has a disc issue. Pain starts out of nothing. Seemingly innocuous activities like bending forwards or picking up a piece of paper will suddenly cause you to have a spasm. Now it's truly a muscular spasm, but it's occurring not because you are overusing your muscles. It's occurring because there's something irritating deep inside that's making your body want to immobilize itself. So if you have a painful disc, your muscles will get stiff and your body will try to get you to stop moving. That's the explanation why we always have so much muscle pain, even though the problem in vast majority of cases is a degenerative disc. Thank you for this great question, Lola. Our next question comes to us from Sage, who reached out via Facebook. Sage asks, "Hi doctor, I was just told that I have arthritis in my neck. Is that even possible? I always thought arthritis only happened in the hands." Sage, great question. So arthritis happens to any joint, and we have two joints for every vertebra connected to the level above and the level below. So those joints are real joints. They move. There's cartilage, there's joint fluid, and with time, especially with loss of disc height, those joints tend to become deformed and cause pain. It's not a sentence. It's actually an easy problem to treat, especially if you go to a pain management doctor or a spine surgeon like myself. And most of the time, that arthritis in your neck will not require spine surgery. I hope this gives you some great news. Next question. This one comes from Ezra on allhealthtv.com. "Dr. Brusovanik, I'm a collegiate gymnast. My back has been bothering me lately, so I recently asked my cousin, who is currently in med school, what she might thought it may be. She said it could be spondylolysis. Please tell me what it is and what can I do to treat it?" Wow, Ezra, that's a really specific question. And applause to your cousin, because she or he may be right. So, gymnasts, by nature of the sport, tend to bend backwards quite a bit. There is this one reasonably rare abnormality that's essentially congenital, where a failure of formation occurs and a little bridge of bone involving usually L5, sometimes L4, fails to form. Without that bridge of bone, the entire vertebra becomes weakened and it stops resisting from forward flexion, meaning that if you look from the side, as all your bones are lined up, spondylolysis allows your spine to slowly but surely start to shift forwards. And when you have that, the pain that is characteristic is pain that can be elicited by putting your hands on your waist and bending backwards. So, if indeed you have pain bending backwards, when you have the associated findings like difficulty laying on your back or pain going down the legs, you need to speak to a specialist like myself, a spine specialist, and obtain an MRI and possibly even a CAT scan. Don't despair, this is a fixable problem, but if you indeed have it and your cousin is right, then it's a good idea to get it checked out. I hope this helps. We have one last question. Dr. Brusovanik from Nico. Where do you stand on getting second opinions, especially as it pertains to surgery? Nico, I get a sense like you may have heard my show in the past. I am a big fan of second opinions. In Russia, there used to be a saying, before you cut once, you measure 3 times. You can be worse with spine surgery. And if you're suffering, you have one chance to really get it straight, to get it perfect. Talk to at least 2 or 3 doctors and make sure you have a great connection with whoever you choose to trust with your back. I hope this helps. See you in the next episode of Ask the Doc. No appointments needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.